Ricky Nelson. Okay. Hey, good evening. Can I take the Lipodrops for men if I have diabetes? The Lipo-T, which is the product for men and male enhancement, that's a product that increases your testosterone level naturally. It increases your libido. It allows a man to have longer, harder erections, and there are great benefits from that. And if you're a diabetic, then if you haven't already started having challenges in consideration with erectile function, then you will. That's one of the problems with diabetes. Diabetes does damage to your blood vessels on a cellular level, and the mechanism of erection is one of blood flow. Blood flows into the penis. There's a gate that's kind of like the Panama Canal. It closes, holds the blood in there. You have intercourse until you ejaculate. When you ejaculate, that's the signal for the gate to open. The blood comes out. You lose your erection. That is what happens 100% of the time. People be saying, "Oh, I can go all night. I can ejaculate over and over." Well, you might, but you will always lose it after ejaculation for some period of time because that's the natural cycle that you go through, your sexual cycle. But after 15, 20 minutes, the gate will close again, or is capable of closing. If you're stimulated, blood comes to the penis, the gate closes and holds the blood in the penis. Well, when you have diabetes, the gate gets leaky or the blood flow to the penis gets compromised. So you don't have long and hard erections. You start to get less hard erections, less long erections. Eventually, it gets to a point where you don't have erections at all. That is oftentimes how a lot of men are diagnosed with diabetes because they're ignoring every other symptom that they have. They're ignoring being thirsty all the time. They're ignoring urinating all the time. They're ignoring weight loss. They're ignoring the foul keto breath that you get when your blood sugar gets too high. So they get through that. But then when they start having difficulty having erections, they come to Dr. Collier and say, "Dr. Collier, I need some Viagra. I need some Cialis. Something's going on. I need some help." And then I say, well, let's do a complete comprehensive physical on you and examine you. And oftentimes we'll find that person is diabetic. Now, you can help the disease state with those things, those supplements like Cialis and Viagra. But the objective is to fix the primary problem, which is the diabetes. And then you don't need those things. Then you don't need those things unless you have other problems. But those correct the plumbing issue or help with the plumbing issue, which is why they work. Versus our product, the Lipo-T, which helps with the plumbing issue, but also helps with other things like the low testosterone level, the decreased libido, and other issues that you can have when you're having erectile dysfunction. It is a comprehensive product that contains multiple things in it to help with that, and you also take it every day versus taking it right before intercourse. That way, you're always ready and you obtain a certain level of sexual, physical fitness that makes you a better lover and a better man, makes you the man that you used to be back in the day, as we like to say. Okay, great question, Ricky.